And I'm also a member of the grassroots organizations Advocates for Disability Supports. And our vision is that Oregon's disabled children deserve to have their best qualified caregivers. Parents should be allowed to apply for the jobs of in-home care providers to their minor children. Advocates for Disability Supports, like I said, is a grassroots effort of parent volunteers. We are currently working with many families, legislators, and organizations to submit bills in the 2023 legislative session in Oregon for a permanent policy that would allow all intellectually and developmentally disabled children who receive attendant care services to choose their parents as their caregiver. We have 12 state senators, 21 state representatives, and organizations such as the Oregon Disabilities Commission, the Oregon Pediatric Society, Oregon Family Support Network, Oregon Family to Family Health Information Center, Oregon Federation of Nurses and Health Professionals, Northwest Kidney Kids, National Council on Severe Autism, and of course, the Autism Society of Oregon, who are supporting this proposal. So our argument is pretty simple. Caring for a child with a disability involves work. That labor is spelled out very clearly in annual assessments and is paid for through K-Plan in Oregon. And we believe that the person doing that work should have the option to be able to be paid for that work, even if that person is a parent. During the temporary program, we have also seen how doing so leads to better outcomes for kids. So this stuff gets really complicated really fast. So I'm going to start at the basics. What is developmental disability services? In Oregon, we have the Office of Developmental Disability Services that administers many of the programs for disabled adults and children. They are mostly subcontracted to local county offices to manage. Or ODDS is under the Department of Human Services and not the Oregon Health Authority. Despite that, they pay for many of their services with Medicaid dollars. Home and community-based services is the type of Medicaid dollars that ODDS uses to fund in-home caregiver hours. HCBS was the result of the deinstitutionalization movement as people realized that children with disabilities ought to be raised at home. So there are many different types of Medicaid waivers in the country, and no state has the same mix. The waivers that cover in-home service hours for minor children in Oregon are called either K-Plan or CIAS. K-Plan is named after Section 1915K of the Social Security Act, and it covers most children, around 12,000. CIAS is Children's Intensive In-Home Services. That program actually consists of 3 different 1915C waivers that each carry a maximum of 200 kids. So that's a maximum of 600 spots combined for the state's most medically fragile, medically involved, and behaviorally complex kids. Or at least those of whom who hear about this specialized program, jump through all the hoops, and wait years for their number to come up. So what is the difference between this 1915C waiver and 1915K waiver when it comes to paid parent caregivers? 1915C is the clearest path to doing this. Colorado has been doing it with their waiver for decades. But the federal government also says it's okay to do through the 1915K waiver. California has done it through their 1915K for many years as well. I'm not going to complicate this, but there is also a 1915 or an 1115 waiver that Arizona uses. So that's another option. So we also want to explain what are these hours? What does that even mean? So attendant care hours is a monthly allotment, and they are for activities of daily living. Hold on. Okay, so under the 1915K and 1915C programs in Oregon, the annual child needs assessment spits out a certain number of attendant care hours per month and a much smaller number of respite care hours per year. Attendant care hours are to help your child with what are called activities of daily living, ADLs, or instrumental activities of daily living. ADLs are the things that they need to survive or get through their day healthy and safe. These are things like eating, dressing, toileting, transfers, bathing, behavior management, etc. IEDLs are like housekeeping, laundry, shopping, and typically apply to adults or older children. It's also important to note that Oregon will be moving from the CNA, the Child Needs Assessment, to the Oregon Needs Assessment for calculating hours, we think in about 2025. So how did parents become eligible during this temporary emergency? So one thing to understand from from our perspective is that K-Plan's in-home helpers program was designed for adults and never really worked well for children. My child was on it when it started in 2014, and I have only ever been able to get a fraction of the hours filled. Many people I know are in the same boat. In 2020, COVID happened, and you really couldn't have a parade of strangers in and out of your home. So parents of disabled adults could already be paid caregivers, but not those of minor children. So the federal government issued an 1135 waiver that made it so that in February 2021, Oregon could start allowing parents of minor children to be paid for their attendant care hours. The 1135 waiver is tied up with a whole bunch of other things in the COVID-19 public health emergency, like telehealth and emergency funding for hospitals and all of that kind of stuff. It's just kind of a tiny part of that big program. The public health emergency ends every 90 days and then gets extended. The Biden administration has said that they will keep extending it until at least April. And who qualifies under the temporary program? Oregon parents of minor children could only be paid if their children were on CIIS or if their child received 240 hours more per month. Okay, oops, I think I skipped too many. Yes, okay. What about a permanent program? So because this temporary program, at least in our view, saw such good outcomes for children, this grassroots movement, Advocates for Disability Support, started to agitate to make this a permanent option in Oregon. ODDS said they would not implement it without input from the legislature, so there's been a lot of people meeting with legislators to make the case. That has resulted in two proposals, one from Senate Majority Whip Sarah Gelser-Bluen and another from Senate Minority Leader Tim Knopp. In the most basic terms, the main difference between their bills we think, is that Gelser-Bluen would cover kids under the C waiver and Knopp would cover kids under the K waiver. But we're still looking for more details that should be coming next week. So as part of our advocacy, we surveyed 94 of the 300 families that were taking advantage of the current program, and the results were pretty stunning. 7 out of 10 families said that even before the pandemic, at least one parent was required to stay home full-time to care for their disabled child. 89% of families reported their child's physical health improved after their parent was able to be their child's paid caregiver. 90% said mental health improved. Almost 70% of families reported being able to access the community more by having the parent be pulled back from the brink of homelessness due to this program. Our organization sees a lot of benefits to removing the barrier for parents to serve as support workers. It increases consistency and predictability for children, decreases stress and trauma, increases independence and community inclusion, promotes quality caregiving, improves outcomes over the lifespan of the child, increases federal funding to Oregon and rural communities, lowers the family's need for other government programs like housing and food, increases the capacity of the parent to advocate in other areas like K-12 and healthcare, increases the family's ability to find and train outside care workers for respite. This is really important. We saw that under the temporary program, people were actually more able to hire and find outside caregivers. This is not an us versus them thing. This is not a black and white thing. It's better for all the different scenarios that children need. So as we're talking to the legislature, we're asking for the prohibition against parents serving as paid caregivers to be removed. We're asking that all children with needs high enough to qualify for in-home support hours would be able to benefit from this program, that parents would be able to claim any attendant care hours, but not respite care hours. Parents would receive the same level of training as any other DSP or PSW, and that parents would not need to give up decision-making authority for their minor child. So some questions that are often asked include, what about self-determination? Self-determination is a key goal of this program. Parents will be paid to do the same job as any other person that we would hire to perform that task. This gives our children the option to have a paid parent perform the most intimate of tasks and not delegate those to a stranger when that is preferred. Parents are are often already the full-time caregiver, and we need to trust that a parent knows what they need. Parents can and often do have outside caregivers when they're available. And ODDS data, as I said, showed that paid parents actually increase their utilization of outside caregivers. Yes, we get burned out, but the majority of people who have used this program say that they are less burned out than they were before. You may ask, is this an income assistance program? No, these are jobs that have defined tasks and wages that the state would pay almost any adult to perform. The economic justice that these families would experience and the resulting benefits are added bonuses of paying parents for the specialized care they already performed for their child. Currently, all that's required of a caregiver is a background check and roughly 24 hours of training. Parents pick up the slack and provide the training to in-home caregivers. Each child is unique, and parents are considered the experts in knowing their child's individual needs and how best to meet them so that they can train in-home caregivers. So some service deserts and the unique needs of the child, insisting on an outside provider makes no sense. The Oregon Disabilities Commission said it would be, quote, nothing less than taking a step back in history via the child's front door. This is a service equity issue. We're in a labor crisis with hundreds of children on waiting lists and no caregivers to send. And what about the cost of implementing a program like this? I mean, honestly, it would be budget neutral if Oregon's promised hours to disabled children were real, but as it stands, they're only a mirage of services. It will cost more, but only because this is an effective solution to fulfilling Oregon's promise to support disabled children. And the next steps, on December 9th in the morning, that's next Friday, Senator Gelser-Blouin and Senator Knopp will each present their bills to the Senate Human Services Committee. On December 9th at 3 p.m., Senator Gelser-Blouin is holding a stakeholder group to discuss the bills. The bills will be introduced in the 2023 legislative session, which is between January and June of next year. And we'll be notifying of opportunities during the session to submit public comment or testimony. You can join our Facebook group or follow Advocates for Disability Supports on Facebook. By June 2023, we'll know if something has passed. Importantly, this legislative process will only point to an administrative process. ODDS would then need to write the program into existence and Medicaid would have to agree to it. There would be another opportunity for public comment during the application process to CMS. And we hope that this could be implemented as soon as July 2023, but it'll probably take longer to get all the details ironed out. Emergency funding for the temporary program is set to run out in April 2023, like I said, but it could be extended. That's it. Look at me, 20 minutes. So now it's your turn.
Excellent job, Shasta. Excellent job, Shasta. If you want to stop the screen sharing, we'll go back to seeing everybody. If you have any questions for her, please put it in the chat. Shasta, are you going to be sending out your slides, or do you want to put in your email or some way that people can contact you?
Yeah, absolutely. I can send out the slides.
Okay, send them to me and we'll get them out to everybody who signed up.
Okay.
Okay. So now it's your turn. We want to hear from you all. I want to say preemptively that the group that Shasta works with, Oregon for Disability Advocates for Disability Services, you changed your name and I forgot.
Yeah, we did. A little simpler. Advocates for Disability Support.
Yeah, obviously they are in favor of extending and expanding this program. The Autism Society of Oregon is also in favor of that as well. So I don't want to mislead anybody on that. And I will say personally, my family benefited from it. My child is now 18, so it no longer impacts us personally, but personally, I'm in favor of extending and expanding this program as well. So I just want to be clear and open and transparent about where I personally stand and where the organization stands on this. But we would like to hear from everybody, pro and con, because we need to hear what the community's thoughts are on this. As I said earlier, and for folks who came in after I gave my little introduction, we are recording this session. If you have problems with that, if you do not want to be recorded, then I'm sorry, but maybe forego your turn to speak because everyone else has been in favor of it. What we're going to do is I'm going to go through the list of people who signed up and asked to speak in order. We're going to have 2 minutes per person, which, as someone who does a lot of public speaking, is actually a lot longer than you think. Oh, good. Someone's submitting this. And I'll also give you like a 20-second warning when you're getting close to the end of your time. If you are not speaking, we would ask that you keep yourself muted just so we don't get a lot of background noise. The rules are, say whatever you like. We put some sort of thought guidelines when people signed up, but you're welcome to speak whatever your mind is. But the rule is no personal attacks, and that includes on government employees. So it's perfectly fine to say what action someone has taken. It's not fine to ascribe, motives to them that you don't know, or to make personal attacks on them. If when you signed up, you didn't ask to speak, you still can. Just put your name in the chat, and once all the people who signed up to speak finish, we'll go to those folks, and we should have plenty of time. And then finally, I wanted to say that we did have a couple people who signed up who asked for Spanish translation, and unfortunately it was after my week in advance deadline, so I couldn't get anybody. But we will provide a translation of the transcript for those folks. There is a couple of questions in the chat that I think Shasta is responding to, but definitely if you've got questions, reach out to her. She's much more the expert. And I'll also check the chat while we're going along to see if there's anything that needs to be responded to. So with that, we're going to get started on having people speak their piece. The first three up I have are Megan, and I'm sorry if I mispronounced this, Megan Robledo. And then after that, Ra Al-Hati, and then Whitney Van Brocklin. So those are the first three. If Megan is here, go ahead and unmute yourself and feel free to start, and I will start timing. Okay, and give it just a couple seconds. Is Megan, and I'm sorry, Robledo available? If Megan's not here, I'll put your name on a list and we'll come back to you at the end in case you show up later. We know how life is. And instead, we'll start with Ra Al-Hati. And I know I admitted them. Hopefully they're here. There you go.
No worries. I'm here, and I'm sorry I am driving and my kiddo is in the back, so he might scream. But real quick, and I missed the first introduction, but my whole take on this whole entire thing is, like, obviously very supportive of this program. Our biggest struggles have always been finding caretakers. You guys called it out. Labor shortage has been a big crisis all across. And then the second thing is, when we do find caretakers, unfortunately with our kiddos specifically, we haven't had luck with anyone that can manage him solo. And so we've really struggled being able to find that caliber of, like, a DSP that can really, support us and give us that time back. I mean, we typically end up staying with them the whole entire time. So that's just my, I just wanted to share that thought, but
Okay, thank you, Rye. Anything else you wanted to add?
no, that's it.
Okay, great, thank you. And just to let you know, that was just about a minute. So in case people are wondering how much time 2 minutes works out to be. So thank you, Rod. Next up is Whitney Van Brocklin, and then after that, Richanda Lafferty. So Whitney, if you would like to go, please unmute yourself and feel free to start.
Sorry, can you hear me?
Yes.
Okay. I'm just trying to navigate it. I'm also juggling kids and stuff. Just lost myself in the garage, hopefully. My husband's in it. So I have a lot to say on this, but I know there's not much time. I coincided and I'm sure agree with most of how everybody else feels about this. We have this was very new to us when JT was born. My son, he was diagnosed when he was 2 with autism. And so the most experience I had before that was with just when I was a kid and I'd help out with the LLC classrooms and people that I knew, but I had no idea what I was getting into. When I was given the opportunity, I've always felt like since his diagnosis, we've just been flooded with resources and help, which has always been very much appreciated. And I honestly feel like we're lucky to be in Oregon because it seems to be more supportive than a lot of other states in this situation. But when I was given the opportunity to work or be paid as JT's caregiver, it was kind of a game changer for our whole family. My son's almost 9, and we are a year into me staying home full time. Before the offer, I was struggling to hold jobs that worked with our family schedule. I have 2 other kids. I know this is something a lot of you other parents or caregivers can relate to. Not easy to explain the hardships unless you've kind of been knee deep in this.
Whitney, you've got about 20 seconds.
Okay, and then having the understanding, I feel like, is the hardest part to push for, like, towards the people that are making these decisions. And so I feel like I've been trying and kind of getting the runaround on who can I talk to, because I could write books and go on and on about how this has completely changed my son, and not just my son, but everybody that is, has been involved with him his entire life. They see it 150%.
I'm sorry to break in, Whitney, but that is the time. We're going to have time to talk more. But definitely for help and who you can reach out to, I would check out, contact Shasta or Lisa Ledson at the Oregon for Disability Services Advocates. I'm sorry, put the name in the chat and I'll remember it once I see it. I'm really bad with auditory stuff. And Whitney,
Yeah,
I'm sorry to cut you off, but was there anything else that you didn't get to say real quickly?
Oh, yeah. I mean, like I said, I could go on forever about our stuff. I think my biggest frustration right now, because I am ready to just like kind of fight a little bit more than I have, instead of just sitting and being like, well, this is the way it is. And I don't know who to go to. And I get a lot of kind of run around in circles and people don't know the information to give me or whatnot.
Well, definitely go ahead with Shasta, if you'd put the link for the group in the chat, and we'll also send it out with the with follow-up to everyone in the group.
Yeah.
Okay.
Awesome. Thank you.
Sure. Thanks, Whitney. Next up is Richanda Lafferty, and after that will be Charisse Monette. So, Richanda, if you're available. We'll give it a couple seconds to make sure you can unmute if you're there. If not, we'll come back to you at the end, because how life is, and sometimes you have to drop in and drop out. Okay, so Rishanda's not there. Oops, went too far. Next up, it will be Charisse Monette, and then after that, Joel Ma. So Charisse Monette, if you're available, please unmute and feel free to get started talking. All right. All right, we'll give it next to Joel Ma, followed by Heather Donovan. Joel Ma, are you available? I see that you're here. If you can unmute and start talking, you're welcome to start. Okay, Joel, maybe you stepped away for a little bit and we'll come back to you. So after Joel was Heather Donovan, and after Heather will be Nicole Clark. Heather Donovan, do you want to unmute and start talking? Okay. Nicole Clark, are you with us and would you like to say anything? Okay. After Nicole, Courtney Coleman. Courtney, are you here and would you like to talk with your thoughts on this?
Hi.
There you go.
Yeah, I think a lot of people are probably just having a little bit of trouble navigating how to get back down to the features. At least I do on my phone. So anyways, I am the mother of a beautiful 13-year-old girl with Rett syndrome and coronary artery abnormality. Frankie is really the lead actress in this play we call life. We are a pretty large family. We're a family of 6 now because I also care for my 97-year-old grandfather. And I will just say that this paid parent caregiving opportunity because of the emergency has been a lifesaver for our family. It certainly hasn't allowed anybody, I don't think, to make hand over fist, but it has been a blessing to finally be able to pay our bills and not have to rob Peter and pay Paul, if you will. I will say that if anyone has had an opportunity hasn't had the opportunity to maybe look into the plans for both Colorado and California, there are some significant similarities, but also some vast differences. And based on the information that I know, because I have friends with complex kids in both places, I would lean towards the California legislation more than Colorado, specifically because you are required to become a certified nursing assistant if you become your child's paid caregiver in the state of Colorado. So with that being said, I just really appreciate this group. I really appreciate the support because we are doing the majority of the work. My daughter weighs 95 pounds and is 4'9", and I'm 5'4" and 135 pounds. So it's hard work and nobody else can do it. And so, and she doesn't want anyone else to do it. She's developed and she trusts me infinitely. And to be honest with you, she's my best friend. So thank you all very much for giving me the opportunity to speak. And I'm just really grateful for the support. Thank you.
Thank you very much. I'm just letting people know we had one person say that they had to leave to take care of their kiddo. So we're going to send the transcript and the slides out to everyone when we're done. So if you have to go, we know how it is to have to care for your kiddo. Okay, appreciate that, Courtney. I did just want to check back to make sure if anyone was having trouble figuring out how to unmute themselves. I'll go back to Joel Ma and see if you would like to speak. If not, that's fine. But I don't want to drop over you if you really did want to speak. I'm just giving it a minute here. because the next person up after Courtney is going to be Yesenia Espalat. And I'm sorry, I've probably destroyed that name. Yesenia, if you would like to speak, you can go ahead and unmute and start. Now, Yesenia was one of the people who had asked for translation, which I'm sorry I don't have because we got the request too late, but we will be sending out the transcript translated into Spanish. Okay, not hearing from Yesenia, and I'm hoping that it's not because you can't unmute yourself. If you're having problems with unmuting yourself, like I said, I will come back, but also maybe put that in the chat and we can help you with that. Teresa, I know just said she had to leave, and I'm sorry you won't be hearing from her. So next up is Jennifer Witten, followed by Sonia Landy. So Jennifer, if you'd like to unmute yourself and start talking, you're welcome to. Sorry, I don't have the connection for it today. I'm not sure what that means, Jennifer, but I'm gonna assume that you're unable to unmute yourself and talk. So we'll go to the next person, who will be Sonia Landy, followed by Sunhee Lamson. So Sonia Landy, if you would like to talk.
Hi,
There you go.
Hi, thank you so much for giving me this opportunity. Yes, I would like, so when I said yes, I would like to talk, my main worry was to make sure that I could be considered for testifying when this will go to legislator, because I think it's very important to give our testimony, meaning our problem are more real. And so, yes, I would like to know how can I make sure to be in contact. I will look up for these links and make sure I can give my contribution. And because I think the most important thing also is to make sure all kids, all family have recognized this right to be allowed to work with their children. Because, for instance, in my situation, I don't have family around. Most of the family that are in the K plan, most of them, they have the opportunity to use friends, family members, which they trust. While in our case, there is no family around, so we could not use this service with the families. And we are in the situation that often we need to trust people that as other parents already said, they are a total, sometimes disaster. So, and it's true, likewise, the other mom said, there are tasks that my son doesn't want to do with the caregiver. Often in time, while the caregiver is home, I am helping my son with some tasks because he is he's ashamed, especially when it's about personal care. He doesn't want a stranger to help him, but he has a disability, he's not able to do that by himself. And I am helping him while the caregiver paid by the state is sitting helpless. And the other thing is, we have this survey that are giving confirmation that allowing parents to work with their children is helping family and children. The outcome of all of this service, of course, there will be somebody that will say, oh, okay, but how we preserve the well-being of children with disability that maybe are abused in their family. So I understand that maybe somebody will have this concern, and I too, as a mom, I can have this worry for children that maybe are abused in their family. And so maybe we can propose something like, I don't know.
Sonia, I'm just gonna drop in to let you know you've got about 20 seconds.
Yes, I mean, we can propose to the legislature, I don't know, make sure that parents do drug tests periodically. I don't know, everything gives peace of mind to this legislator. We can propose to them. Important, we we have this chance to improve the quality of life of our family, because it's a constant intrusion of your privacy, your family. There is never a moment of peace. You have always these people around, and some of them are totally incompetent. And so it's
Okay,
just
thank you.
frustrating. Thank you
Yeah.
so much.
Thank you,
Thanks.
Sonia, and I'm sorry to interrupt. I have marked down that you would like to testify, and I'll make sure that you get those links when those are available.
Thank you so much for doing that. Thanks.
Of course, take care, and thank you for speaking. Next up is Sunhee Lamson, followed by Dulce Ojeda. And oh, by the way, we've had enough people drop out from speaking. I've moved it up to 3 minutes. So,
Okay. Oh, hi. I have benefited from this program for last few months, and I am so grateful. It just made so much difference. Before that, it was really hard to find a personal support worker that is a good fit. Like, some people didn't show up for the interview, or it was stressful to have some of them at home. Because my child, he's nonverbal, and depending on the person, he can be open and he can type things, but with others, he just totally shut down and non-responsive, and that was the case. And so even when I hire someone, they come here, but I'm helping, like Sonia said. So it wasn't really helpful to have someone. And plus, because of the communication issues, that I wasn't comfortable sending my child with someone out without me, without my supervision. So the program did not work very well in my case. And being a single mom, I'm trying to juggle between things. So when this program started, for us, it was about 3 months ago. It was like a huge relief that I can spend more quality time with my child without rushing, and I could take him more out into the community. And he's less anxious. He's not chewing his shirt as much. So yeah, it was like a no-brainer, right? I'm 100% sure that I'm the best caregiver for my child. So yes, I am supportive of this program continuing, obviously. Thank you so much for this opportunity. Thank you.
thank you, Sunhee. I am gonna stop that. Okay, the next person up is Dulce Ojeda, and followed by Paige Enderley. So Dulce, if you're here and would like to unmute, we're giving everybody 3 minutes to talk and state their opinions and thoughts and how this program has affected them. I just want to give Dulce a couple more seconds to see if they have any problems unmuting. Okay, I'll put your name down, Dulce. If you are able to join us or to unmute later, we'll come back to you. And instead, we'll go forward to Paige Enderley, followed by Jennifer Haggerty. Paige Enderley, if you're here and would like to unmute and so we can hear from you, we'd be delighted to hear from you. Okay. After Paige was Jennifer Haggerty. Jennifer, if you're here and would like to talk, please unmute. All right. Next up after Paige is Vanessa Laura. And Lisa Ledson, I'm skipping you for your request, but if that's changed, just let me know. Okay, got a thumbs up from Lisa.
Hi.
Hi, thanks for joining us, Vanessa.
Hi. So I've been in the paid program for about a month. My daughter has cerebral palsy. She was on the DDS service, but she would only qualify for like a small quantity of hours. So when the COVID emergency hit, she was not eligible for me to be paid to care for her. She had a big decline in her health around June. She went into respiratory failure. She ended up needing a tracheostomy to come off the intubation. So we spent like 9 weeks in the hospital. She's now bed dependent, and well, she lost a lot of her abilities, so she really requires a lot of care now. So when we were discharged from the hospital, we were told she qualified for nursing hours. And we live in a rural area, and there is not nursing agencies that would work with a child. So we were left alone, my husband and I, to care for her, and to find someone that would be willing and comfortable with helping us care for her with the trach and the ventilator. So husband hasn't been able to go back to work. Then when she was starting to be transferred to CIIS, I was told that the paid parent was still a thing because I thought it was over because of COVID restrictions were lifted and everything. So when I found out about it, I was advised it was gonna end in October. They told me to apply, and I did, knowing that it was probably gonna end. But the expansion of the program has really helped us tremendously, because my husband and I are the only ones that know how to care for her with the trach. We do have some other family members that are paid caregivers and help us with her, but we really have to be here for any emergency. So the paid program has really been a blessing in our situation, because she needs monitoring even overnight. So we really have to take turns, and yeah.
Okay, you
That's
got
our
about 20
story.
seconds. Oh, perfect.
Yeah.
I was just about to give you the 20-second warning. So thank you so much, Vanessa. We appreciate hearing from you. I've heard from a couple people that they've only recently started participating in this program, and that's a concern if they were eligible starting in February of 2021 and are only just now starting. It may have been that some only became recently eligible, but yeah. Yeah. But I'm glad to hear that it's going to be apparently qualifying for until at least April. It has to be renewed every 3 months. So that's why we kind of give these ongoing deadlines. Next person up I have on my list is Jessica Franklin, followed by Richard Street, S-T-R-E-I-T. So Jessica, if you're with us and would like to talk, please unmute and feel free to start chatting. I give it a few seconds to make sure, because sometimes it's hard to find that unmute button. Okay, so that's Jessica Franklin. And if she's not available, we'll go next to Richard Straight, followed by Alondra Rogers. And I apologize if I'm messing up anybody's name, which I probably am. But Richard, is it Street? If you would like to unmute and start talking, please do. In a few seconds. Okay, if Richard or Jessica are able to join us later, just let me know in the chat and we'll get you started. Next up would be Alondra Rogers, followed by Jade Christensen. So Alondra, are you here and would you like to share with us today? Okay, with that, we'll go to Jade Christensen, followed by Richard Muirhead. Jade Christensen, are you here? Okay, Sheila, I'll put you on the list. Okay. Richard Muirhead or Martha, whichever one of you are here, please feel free to unmute and let us know what's going on. And I happen to know Rick, Richard and Martha. I remember letting them in, but they may have had to take care of their child. Okay. Next up would be Ryan, and I'm sorry, Ryan, is it Ciccocchi? Cichocki, followed by Cecilia Frias. So Ryan, Cichocki. I'm not even gonna try. Okay, we may just start getting into questions. Right. Cecilia Frias, would you like to speak? And if not, next up is Dee Collins, followed by Maricela Osegueda. I'm going to guess on that. Cecilia, give you a few minutes, few seconds. Okay, how about Dee Collins? I missed Dee when I was going through my list. Dee Collins, would you like to say a few words for us or share what's your thoughts are? Right. If I'm going through these too fast, let me know. If you did want to speak and I've gone past you, just put it in the chat or just start speaking up. After Dee Collins would be Maricela Osegueda. Maricela, would you like to share your thoughts with us? Okay. After that is Natalia Parra, or P-A-R-R-A. Natalia? Alrighty. There we go. Following her, Natalia would be Martha Gamez, G-A-M-E-Z. Okay, how about I have A. Miranda. Okay, how about Brandy Lobsher? This one's showing me S's. Yep. The next folks up, and I'll go in order, but I want to give you a heads up because we're coming to the end of the list. Next 10 or so are Brandy Lobsher, Cara Rotella, Susan Height, Melinda Corley, Dana Britton, Sheila Harris, Cynthia Starr, Tom Booker, Wani Thomas, Shauna Smith, Chrissy Rose. This is Sokseha Lang, and Jeremy Mothershead. Those are the folks I have left on the list. So I'll go back through those more slowly. I just want to give a heads up in case you're here and want to get ready. So Brandy Lobsher. Brandy, would you like to unmute and share with us? Okay, we'll go on to Cara Rotella. I see Cara in the chat. If you'd rather stick with that and not speak, that's fine too. Cara writes, we've been eligible for hours since we signed on with DD Services back in 2018. No one informed me that this was an option. I found out about it from these meetings and became my child's DSP in September. While I'm so happy I finally was able to get the chance to be a paid caregiver, I'm also very frustrated that we suffered through the entire pandemic without this resource. And that's a very good, I understand why that would be extremely upsetting. And frankly, your service coordinator, your should have let you know about that, Cara. that was on them. We've been trying to get information out as best we can. But I'm really shocked and upset that your care provider or your service coordinator didn't let you know about that sooner. Natasha, I saw your note. I saw Kara re-entered. Gonna give her a chance, one more chance. Kara, if you wanted to unmute and speak, you're welcome to.
Hi, thank you. I'm sorry, I didn't realize that my privacy settings didn't allow for microphone. So,
Oh.
yeah, I mentioned in the chat, we had been receiving hours through DD Services for years, and it wasn't until these meetings and sessions around this change started happening that I was even aware that this was an option. No case managers, no one on any of the services or support teams that we're part of informed me. And so, like I said, that is extremely frustrating because I know I'm probably not the only parent that is experiencing that. But on a positive note, we've been utilizing the hours. I have been my child's DSP since mid-September. And aside from a little bit of uncertainty in the beginning of exactly what I was allowed to clock in and out for, or what specifically was caregiver versus parent responsibilities, it's been absolutely life-changing for our family. I've always had to be the full-time at-home parent, and even with my child in school, there was no stability in our schedule or for me to be able to seek employment because I was getting calls from the school for various reasons to come and deal with issues with my child, or they had medical needs that were requiring my time and attention. And so while this has financially benefited my family positively, it's also been life-changing in other ways of my child being more open and vocal about their needs and feeling more comfortable because they don't do well with strangers and they don't want to seek help because they're ashamed or they're embarrassed. So having me as their sole provider has really helped them kind of come out of their shell and advance some of their skills that we've been struggling with. So overall, it's been an absolutely positive impact on our family, and I really hope it's something that can continue.
Thank you very much, Kara. That's great. I agree, and I'm seeing in the chat about how frustrating it is that people did not know about this option. And like I said, we've been working hard to let people know about it through our newsletter and our social media and that sort of thing. But it should have been made available. You should have been made aware of it from your service coordinator, from your caseworker. And if they did not make it known to you, I would follow up with them with an email, wanting to know what happened, why that ball got dropped. Because, quite frankly, they need to know that you're aware of it now and will be looking for information in the future. Next person up would be Susan Height, followed by Melinda Corley. So Susan, are you available and would you like to share with us? Okay, just wanted to give Susan a few seconds to see if she needed time to unmute. Melinda Corley is next, followed by Dana Britton. Melinda, are you available and would you like to share with us? And I do have a few people who've asked to speak, and I've got your names on my list, just so you know. Okay, after Melinda, we have Dana Britton, followed by Sheila Harris. Dana, would you like to unmute and share with us? Just waiting, just like I said, I want to give time because I know unmuting can be difficult. Dana Britton is up next. I'm sorry. Sheila Harris is up next, followed by Cynthia Starr. Sheila, are you? Yay. Hi, Sheila. Please feel free to start sharing.
Hey, hello. Hi to everyone. So from hearing, I'm late. I'm sorry. Mine is the same thing as the other parents. I got issues going on. I found out, first of all, let me state, my daughter is 14 years old. She's nonverbal. She's incontinent. She just been diagnosed, but not too long ago, she's been diagnosed, several months ago, she's been diagnosed with 24-hour care. So I, again, was not told about it. I came to Oregon 16 years ago. I was working, I was going to school for full time. Make a long story short, God blessed me with this child. This child was not diagnosed in my pregnancy to have any disabilities. And ever since she was born on God's green earth, things have been added on. She was born with Downs. I knew something else was wrong with her, and she got older. I came out to OHSU. I'm out here in Washington County. Then she's been diagnosed with autism, then the seizures, and then everything else came into place. I was told about, I think it's DDS services and stuff like that, but through Washington County, I call it the disabled people. I've been on point. I became a caregiver. Like I said, after I found out what her situation was, I could not work. I started being a caregiver and worked that night to be able to get her needs. As time progressed, she got more illnesses and stuff like that. I found out through word of mouth out here, through organizations, and I just want to put it out there. This one organization called, and she's on here, Miss Shasta, Allow Oregon Disabled Kids to Have Paid Parent Givers. When I connected with them, oh my God, I'm gonna start crying. When I connected with them, they're the ones who told me everything. I came at the services, the people at the disability office, and then they kept saying, and I knew people, it was a hush mouth out here. I knew people were doing it. I don't have family out here. I came out here with my brother after my daughter was diagnosed. Since then, I lost my brother through COVID. And so I'm out here by myself. Now, they are the ones who told me to allow Oregon disabled kids to have, paid caregivers and stuff like that. So I went back to, I guess it's the DDS services and stuff. Miss Shasta, I was online with her. And so I came back, then they said, oh, okay. I'm also PSW. I should have known. I'm a personal support worker and I'm an in-home care. I have 2 provider numbers. They did not come at me and tell me none of this stuff. And then when I came back with the information from Miss Shasta, and then they was like, oh, and then I got another caseworker, and this caseworker, no detriment to him, but he was new, but he did some research and he got me through with the information I got from Miss Shasta. And yeah, so I became a paid a caregiver by the grace of God and through the organization. But then I'm cringed on edge every couple of months because I cannot work. Like I said, my daughter's disabled. She's 24 hours. The school used to call me back and forth. And then I heard through word of mouth that I'm the only one that responds. My daughter has an immune deficiency. She's sickly. And just right now, what I'm going through, she have H1N1. That's going around. No one told me. She caught that at school. I'm the kind of parent that if my daughter has a runny nose, I keep her at home. So yes, I found out about this late. I got registered and everything in November of last year. And yeah, I just want to put it out there that I've been writing our legislators out here and stuff like that. And everything that the organization Allow Oregon Disabled, I have to keep saying that because I don't know the acronym for that. I just want to say kudos to them, and also the Autism of Society. They reached out to me, and because I'm overwhelmed. I have now health issues, behind going. It's my daughter. She doesn't sleep. She has all these things. And I just don't understand. Again, I'm like the other parent. I know I'm not the only one with this situation of my daughter. My daughter can't tell me. She can't talk. They took away sign language from her when she was 5 because they said she made sound, she would talk. She's still not talking, and she's 14 years old. A lot of stuff has not been introduced to me. The schools, she needs an assistant in the classroom, they tell me constantly. So yeah, this needs to be pushed. I don't know how.
Sheila, I'm gonna cut you off. You got about 10 seconds if you want to wrap it up.
Oh,
but-
I'm done. I'm done.
Okay. All right. Well,
I just want
thank
to
you.
put it out there like
Yeah.
that. I'm sorry. I like every parent, it's emotional and physical and mental.
Yeah,
on the parent.
understood.
Mhm.
Well, thank
Thank
you.
you.
Thank you so much for sharing with us, Sheila.
You're welcome.
Next up, we have Cynthia Starr, followed by Tom Booker. And then I saw that Brandy Lobsher has just joined us. And Brandy, we had to skip over you, but I can come back to you after these next two, if you'd like. So let me see if Cynthia Starr is available. Cynthia, if you'd like to unmute and share with us, you're welcome to. Okay. And then after Cynthia is Tom Booker. And then we'll go to Brandy Lobsher if she would like to speak. Tom,
This
would
is
you?
Tom.
Great,
Yeah.
thank you.
Thanks for doing this, by the way.
Absolutely.
Yeah, I have 3 questions. First question is in 2 parts. How do you choose an agency to get your DSP training, and then who pays for that?
So there are many agencies out there. I'll do my best to answer, and I'll also ask Shasta to chime in. There's many agencies. You want to look and contact them about what they offer in terms of pay, in terms of any paid time off or other things that are available, what their requirements are. And then for the DSP training, that may vary. But for example, my husband has been a DSP for our son since he was allowed to do so in February of 2021. And his training consisted of watching some video training on first aid and then going out to the DSP agency and demonstrating CPR techniques that he learned on that video. So that's the only training he had to undertake. I don't know if that's changed.
Yeah,
Shasta?
there was 12 hours of training required, and now it's 24 with the new legislation from this last session. But yeah.
And
So
that's
you
through the
find-
DSP agency, right?
Yeah. So if you're working through an agency, you're a DSP, direct support professional. If you're working through the state, you're a PSW, personal support worker. So there's pros and cons to each. So you'd want to look into that.
And we'd be happy to
And-
talk with you offline about that too.
And your caseworker can give you a list of agencies.
Okay. And then who pays for that?
The
state.
training hours, the state.
The state, okay. And that's through the Washington County Developmental Disability Services people?
Yes, that would
Yeah.
be through your service coordinator, who is your caseworker,
Okay,
your child's service coordinator or caseworker.
correct. Now, she's 17,
Mhm.
turns 18 in the middle of January.
Oh, okay.
And I'm just found out about this about 3 weeks ago. So if I'm able to get that going soon enough, which is a question, does that merge easily into the paid family caregiver for adult disabled children?
Yeah, I can answer that one easily because we just went through that. My son turned 18 in August. And yes, I can go through it more in depth, but what will happen is they will do an adult needs assessment around the time she turns 18. You will get more hours per month from that. And
Gotcha.
it always happens, but it'll just merge seamlessly. I would also suggest really quickly, and we can talk more offline, go through an agency because it's much faster to get signed up.
Oh,
And going through the
okay.
county has been my personal experience. Other people may have other experiences, but my personal experience was we were able to get my husband signed up within 48 hours. And the county was telling us it would be 6 weeks.
Okay.
Okay. So Tom, if you, I'd be happy
One
to
more
put my
question.
email in the
Yeah,
The
do
chat.
that. That'd be great. Thank you.
again, I did it earlier, but I'd be happy to do it again and I'd be happy to talk with you more. Okay.
And last
Oh,
question.
go ahead. One more. Sure.
If the paid caregiver, I was told by Washington County, cannot be the designated payee as well for that you'd have to have another person to be the designated payee. It can't be one and the same. How do you do that if you're a single parent or?
Okay, we're going to need to talk about that offline because that gets somewhat tricky. But there are ways around it. It's the short answer.
Okay.
Yeah.
But my but Washington County should be able to tell me how to do that, yeah?
Yeah, if, maybe, is the short answer. I've put my
If they want
email
to.
in the chat. Please feel free to email me. The caseworkers are not in the business, or service coordinators are not in the business of telling you generally how to get around the rules.
Okay,
Is why I say maybe, but there are ways around it. And oftentimes they simply don't know because there's so much turnover.
awesome. All right, thank you so very much.
Sure. Thank you, Tom. Thank you for joining us. After Tom, I was going to go to Brandy Lobsher, if you would like to speak. And Jennifer Murphy, I got your name on the list.
Oh, hi. I guess I will. Little nervous. And I'm sorry I'm late. I missed the beginning here. But I guess I'm just here to also show my support with continuing the program. I'm recently separated, and I was able to do so because I have an income coming in, and otherwise I can't go to work. I've tried many jobs, many different jobs, and they're not able to accommodate on the level that I need for my daughter. She needs to be medicated every 4 hours around the clock. I'm up, at midnight, 4 a.m., just I wouldn't even have the energy to do most jobs outside of the home. And this has really made a huge difference in our lives. We've had a couple of support workers come in. She does not do well with other people because she can't shower alone. She can't, some of the workers, they won't give her medication on time. So she has reactions, or it's just one thing after, or another worker we were told can't even administer medication. So this program has really changed our lives. And I've been able to get out of an abusive relationship. And I really don't know what to say, but I'm just, I get nervous every time we talk about it ending soon. So
yeah, and thank you, Brandy. Yeah, and that has been one of the impetuses behind this push, is that figuring out every 3 months if this is going to continue or not is really disruptive to every family. So it'd be nice to have that finalized and made permanent. Next up, I have Wani Thomas, followed by Shauna Smith. So Wani, if I've mispronounced that, I apologize. And I apologize to everyone whose name I'm butchering. But Wani Thomas, if you would like to unmute and start sharing with us, you're welcome to. And I'll give that a few seconds to see if you have any problems with unmuting. Okay. After Wani Thomas was Shauna Smith, followed by Chrissy Rose. So Shauna Smith, if you'd like to unmute and start sharing with us, you're welcome to. Shauna Smith, I'll give you a few seconds just to make sure it's not a unmuting problem. Okay, and after Shauna Smith, with Chrissy Rose, followed by, and I'm sorry, Sokseha Lang. So Chrissy Rose, if you'd like to unmute and share with us, please go ahead. Chrissy, if you're here, please feel free to unmute. Not, that's fine. And we will next go to Sokseha Lang, followed by Jeremy Mothershead. And Jeremy was the last person we had signed up to speak, and then I'm going to go to the folks who contacted me that they'd like to speak. So, Sokseha Lang, if you'd like to unmute and share with us. All right, and Jeremy Mothershead, if you're here and would like to unmute, please feel free to share. There's Jeremy.
Hi, everyone. Right, I'm Jeremy Mothershead. This is my son, Henry.
Henry.
He's also cared for by his mother, who isn't here with us right now. We actually had to travel out of state for a family emergency, which is another thing that I'd like to highlight for the program, that you simply can't, leave state and leave your child in the hands of someone else. You end up paying double the airfare, things like that, all kinds of complications. But this program has been really important for us. It has allowed us to, cut out the middleman of a paid caregiver, who is basically a stranger, and is supplementing us to the point of like 45% of our household monthly income. And it's been really important and a good step for us, because before we were just not getting, that in a household with two incomes even. So imagine being a single parent with a disabled child, like I've heard from so many people here today. It's obvious how important this program is. And other statistics, like the amount of abuse that disabled children suffer at the hands of caregivers. There's so many nonverbal kids that can't tell you when they've been abused. It's just the best way to care for these kids. And I also want to thank everyone who's talked so far today, because living out in Eastern Oregon, where it's also hard to find a caregiver, it's also hard to find families like us. And so everyone that's talked here today has made me feel less alone, and I appreciate it.
Well, thank you, Jeremy. That's great. And your son's adorable. Someone in the chat is saying that they're really relating to all these personal stories, and they'd love to stay connected with anyone who's interested. I was about to type, but it might be easier to simply say that, we have the emails for everyone who signed up for today. If you'd be comfortable sharing your email, or if you want to connect with specific people you've heard from today, just let me know. If both people are comfortable with that, we're happy to share emails with people, but we want to make sure both sides would be comfortable with that. You can also connect to and I wrote it down this time, the Advocates for Disability Supports, which is the group that Shasta Kearns-Moore and Lisa Ledson are part of, that's working to promote this legislation and extend and expand the program. They have a Facebook group, and that's been put in the chat, but maybe you want to add it in the chat again, Shasta. That's a great way to connect. So next up are the folks who had reached out and said they would like to talk, and I have 4 on my list. I have Paige Hall, followed by Sheila Harris, Natasha Keltler, and I don't think I pronounced that correct, I apologize, and Jennifer Murphy. So Paige, if you'd like to unmute and start sharing, you'll be followed by Sheila.
Hi, my son is 11, nonverbal, autistic with severe epilepsy. We were lucky enough to get into the program right at the beginning. I just happened to know the right person who heard from their case manager. I have heard time and time again from many families that they only know because I mentioned this to them particularly, and they've been left out. I also keep certain families updated because they can't risk losing their current job to temporarily become a caregiver for their child until it's made permanent, but they're really struggling. Our family was facing homelessness. I was laid off due to COVID, and if I wouldn't have had any of those emergency funds, we wouldn't have made it. If they didn't get this program started when they did, we wouldn't have made it. So if we are financially stable as of right now, but my son's mental health, physical health, behavioral health has just increased exponentially due to this. The bond between us has gotten a lot greater. I get to finally spend quality time with my son. we don't have a revolving door of caregivers or just the inconsistency that caregivers brought. He relies on me for, he can't shower alone. He can't go to the bathroom by himself. He needs help getting dressed, feeding, those kinds of things. Getting to know his language and the way that he communicates can be very difficult, and it takes months to establish a relationship. I mean, I've interviewed dozens of caregivers. Almost all of them have said yes, they would love to work with him. And we've only had 6 caregivers since he was introduced to the K-Plan program 7 years ago. So, and all those people just didn't show up or give me a call back after they agreed to want to work with us. So this program is incredibly beneficial for us. I think my worries going forward would be if they don't pass this program, how are they going to help train people through these agencies to properly give care for these children, because you need to kind of have a background in behavioralism and medical, those kinds of things. I'm more qualified to take care of my son because I go to his doctor's appointments, because I've gone through different programs that are offered through the U of O and that kind of thing to help learn how to help my son manage his emotions and be more regulated, and all the sensory and occupational therapies. None of that is being offered to people who work through agencies. They don't get to have training with that. So that's my big concern, is if they don't pass this and allow us to be caregivers for our children, how are they going to help these people without backgrounds in special education be qualified and be prepared to take care of our children? Because right now we don't have anyone who's more qualified than me. We've introduced some people and they burn out and they don't last because they don't know how to help and how to be with him. So that's our experience. And yeah, thank you for hearing me out.
Thank
And
you
I would
very
love to
much,
give
Paige.
testimony as well. I would definitely be willing to speak at the state level.
I'll make a note of that, but if you'd also put that in the chat, that will help me a lot with keeping track of everything.
No problem.
Thank you. Next up, I have Sheila Harris, followed by Natasha Kletter. I think I got to write this down, Natasha, and I apologize. But Sheila, if you'd like to unmute and start sharing.
I just.
Oh, you already spoke. I'm sorry,
Yeah,
Sheila.
and I'm like, but to all that, I just wanted to say, because I didn't know I was responding to one person. I want to apologize for getting emotional. This last lady who spoke, she was speaking everything I'm saying and was trying to say in one word, and she was cool, calm, and collective. Thank you for that, because it feels exactly the same way. Again, I would like to also say, can I get because I missed the first half, a taping of this. Again, let's say a shout out to Allow Oregon Disabled Kids to have paid caregivers. That's how I found out about this. And like I said, I had caregivers too, and same thing with the other lady. They burnt out or they didn't show. But then again, who would know more than your parent? But me having the training when I was a caregiver and working at facilities and didn't have to do this for my daughter, I got even more. But yeah, anybody out there is looking for a job? Because I had a DSP, PSW in 3 years. So I am like, wow. So I'm gonna get off. Thank you guys. Much love to you guys. And I'm holding back the tears. Thank you.
Thank you, Sheila. And honestly, you never have to apologize for getting emotional about this. This is our kids.
Nobody else is crying. Nobody else is crying.
Everybody else is crying.
I don't mean that as
Just not saying
disrespect.
it.
No, I don't mean that as disrespect, but like my mama said, you gotta get some tough skin. You want to be here to take care of your daughter. Thank you, everyone. You ladies are amazing.
Thank you, Sheila. And
Bye-bye.
the dad, don't forget the dads who were here too.
Oh, daddies, you're number one. Oh, in itself. I love to see a man walking down the street pushing his baby. Oh my God. Sorry about you fathers. Kudos, and you get platinum stars as well as his mothers. Thank you.
And next up is going to be Natasha Kletter, followed by Jennifer Murphy, and then Anna.
I agree with everything that's been said. So many of us have left our careers to take on full-time caregiving, and bringing a stranger into the house is not pleasant. It's not ideal. The specific thing I wanted to talk about was community inclusion, that somebody else is not trained in all of the nuances of our kids, and they're okay, just a second. They're like, okay, just a
We
second,
totally
please.
understand, Natasha.
I need you. Okay, very cool. Can you please go out and close the door? Other people are not, they don't have the eye for knowing a happy stem from an anxious stem. And especially if we're in the community, with
Yes, baby Beach.
cars around and with other people and with fans and
What?
heaters and
Yeah, hold
all of the triggers. So for our kids to be with the safest person that's us, their anxiety is down. They are not going into the community with fewer spoons because now they're paired with somebody else, if that makes sense.
Thank you, Natasha. Let me know if you'd like to speak more. Go right ahead. Or would you like me to come back to you? Would that be easier for you? Hi
Hopefully.
there. Hi, cutie. Oops, you're on mute. You're on mute, Natasha.
Yeah, can you come back to me
Sure.
after?
No problems. No worries at all. Okay, we're going to go to Jennifer Murphy, and then we'll check back in with Natasha and then go to Anna. So Jennifer, if you'd like to unmute and chat and share.
Hi, yes, thank you for holding this opportunity for families. Really appreciate it. My name's Jennifer Murphy, and I'm the proud mom to 2 boys, and they both qualify for attendant care hours. They both have K plan. We're in rural Douglas County, and our family fully supports the paid parent caregiver. Utilizing it has proven to be a pivotal time for our families. It's been the thing that's been missing this whole time to give us the support that we really need. And my children have been the most stable, the happiest, the healthiest, and they've had the most community inclusion by having this. We've never had the caregivers to fulfill these hours that the state says my children need next to their typical peer. And I have always been the one to fulfill them. And the kids, I'm the one that they can count on and give them their consistency. And the 240-hour limit has been hard for me to understand, because the truth is, when my kids had 160 hours, I needed this for my children. I needed access to it. And I just feel that the families really, they're capable and they love their children the most. They're the best caregiver. And we need to trust the families to know what's best for their kids and what works, they know. And again, I just want to appreciate you guys for having this today.
Oh, thank you, Jennifer. That's great. Natasha, I'll come back to you if it looks good.
I'm here. That's my child who doesn't receive services. As I was saying about community inclusion, if our kids are already in an escalated state and now we're trying to get them to go to appointments, or we're trying to get them to walk into a restaurant or a grocery store for life skills, we're not setting them up for success. And it's with us that they're going to be at their best if we want to afford future disabled adults with opportunities. That was basically it.
Okay, thank you. I'm glad you were able to share that with us too. Last person on my list I have is Anna. So Anna, if you would like to unmute and start sharing, please go right ahead.
Hi, my name is Anna. I'm a 5th generation Oregon Trail family. And my daughter is nonverbal. She's been diagnosed with SYNGAP1, which is a rare disorder, and she has epilepsy. When she first started getting epilepsy, she would have up to 200 seizures a day. She would not qualify with that alone for those hours. It wasn't until partway through last year, well, in 2020, she lost her caregiver and had not had a caregiver since. And it wasn't until this year that it had affected her health so much that she had to get a feeding tube. She had just decreased in health ever since she lost her caretaker. And so it wasn't until I demanded that her DD worker add that onto her IFP before she started school that she ended up qualifying for the hours for this program. So I just started this program. I've been in it for 6 days now. But sorry, I'm a bit nervous.
That's okay.
But I wanted to get that out that, you know, I agree. I don't understand with the hours part, because before she qualified for these hours, she only had like 111 hours, but she would have like 200 seizures a day for like 2 years until we got the right seizure medication. And that just doesn't make sense to me, why that would be. You know, why would they not give them hours when they're just like constantly seizing like that?
Yeah.
Sorry.
No, understood.
Anyways.
My son also has seizures, and he had one this morning, and there's nothing more scary than those seizures.
But anyways,
and
the other issues is that, like, I have my own issues like ADHD, and so I've struggled with TSPs like being able to handle that, or agencies being able to handle that, because I'm different, you know. So this program is just really huge to me.
Thank you, Anna. That's a lot to share, and thank you very much for sharing all that. If there's anything else you'd like to say, feel free. I think at this point, we've heard from everyone who signed up to speak or who asked to speak. I think there's been a lot of questions in the chat. I don't know if that's something, at this point, anyone who has a question wants to speak, just raise your hand. I think it's 2:30. If you need to leave, that's perfectly fine. I'm happy to stay till 3, which is what we originally, signed up for. But if you have some questions in the chat that haven't been answered, just feel free to raise your hand and let's just start talking. And I mean, this group in a lot of ways has been a sharing and supportive group. And if it's something that people would like to continue, I'm happy to try and set that up. Kelsey Smith has their hand up. If you'd like to just unmute yourself, Kelsey.
Yeah, hi. I am also a member of the Advocates for Disability Supports. My kiddo is 10 years old, quadriplegic, cerebral palsy, all the things, shortcut, etc. I'm mostly curious. I love hearing all these stories. I love that we've been able to help people and that they're reaching out, and I hope that that continues. And anybody that wants help and support, please feel free to reach out to us. I'm curious, just for the purposes of this discussion, is there anybody that's on right now that is not in favor of this? And I'm just asking because the purpose of this, I mean, I want to be supportive, but also I want to be able to reach out to people that aren't supportive and find out why. And I want to hear from them. And so far, I haven't heard anything, which is amazing, but also like we need to hear from the people that don't support us, why they don't support us, so that we can sort of have a dialogue. And so if anybody has anything to add to that in a very non-judgmental forum, I would love to hear from you. Thank you.
Yeah, that's a really good point, Kelsey. I think everyone I've we have heard from has definitely been in favor. We did try and reach out and say that we want to hear from everybody for exactly those reasons. I could understand why someone, if anyone would like to speak up, they're more than welcome to. I can understand why it might be a little bit scary to do that in a group where people have been so clearly in favor and so clearly emotional about it. So if you would like to contact me through email or after this meeting, you're more than welcome to do that. And Shasta can probably tell more about some of the reasons against it. Quite frankly, they make me a little angry. So
I did put in the chat, and I can put it in again. There was about a 4-page letter that the Oregon DD Coalition sent out in April of this year that kind of enumerated their concerns on this legislation, and I can put that in the chat again. But much of it was what kind of we discussed earlier, that parents would get too burned out and that children wouldn't be able to self-determine. They'd be locked into their parent being their only caregiver, things like this. So
that parents sometimes are abusive, that parents would be dependent on this income, that parents, and this is the one that really drives me crazy, is the idea that parents are not the best caregivers for their children, but they are more than happy to rely on us to be primary caregivers as long as we're not paid. Somehow when parents become paid, it becomes a different situation. And that is something that I have a very difficult time with that argument. But I mean, I think there's no getting around the fact that there are some parents who are not good caregivers and who are downright abusive. And but I don't think that's a hurdle that can't be overcome. There needs to be, because parents as unpaid caregivers, there's no oversight except from your basic child protective services. If parents are paid caregivers, then there's more opportunity both for training, which my husband was really happy to have, and for oversight of those parents, to look for those abusive parents and weed them out. I think you're much more likely to be able to identify abusive caregiving parents if they're being paid than if they're not being paid. There was also an argument that it would be sort of in the parents' best interest to keep their children from being as independent as possible, to keep getting this paid caregiving money, which I find more than insulting. Because once again, there are parents who are not great parents, but the idea that we parents want to keep our children dependent in order to continue making money off of them. Well, parents of adults are paid caregivers regardless. So really that argument applies more to a parent of an adult caregiver, of an adult, than a parent of a minor child.
And I do think that actually a lot of the experiences that I've heard of that really speak to the issues between parents being paid caregivers is about the adult population. And I can see how after you turn 18 and you want to go to a bar or you want to do whatever and your parent doesn't want you to, they're not your parent in that instant, they're your caregiver. But it's just really different when we're talking about minor children, because it's not like my child can just go down to Safeway and buy a bunch of candy. He's 12. Like, I'm still the parent and I still get to decide whether or not he does that. So I really feel like there's an opportunity to partner with some people who feel that way on the issues in the adult care system. That, I can see how there's some conflict areas there with some transition programming, with some, self-advocacy skills that these teenagers, when they become teenagers, can develop. But I just don't understand why it has to be like a conflict at the minor child level.
Yeah, I think also what it basically boils down to, and anyone feel free to raise your hand or just unmute and join in. And I see Whitney's hand up. But I was just going to say real quickly, Whitney, and then I'll get to you, is that I think what it basically boils down to is and I know this has been expressed by DD Services in the past, the idea that parents don't get paid to care for their children, that we do it out of love, and that any payment is somehow reducing the love we have for our children. And I think that that's a philosophical view that doesn't make any sense to me, because we have clarified, yes, we do love our children, but our children have support needs that go above and beyond a typically developing child, which the state has very nicely outlined for us exactly how much extra care our children need. And I mean, I won't even get into the philosophy of not paying parents to care for their own children, because I don't see any problem with that with typically developing children. But I think it's even more for a child who is not typically developing. But Whitney, I'm sorry, I didn't want to talk over you. Please go ahead. And then Margie, did you have your hand up?
Can you hear me?
Yes.
Okay, good. Yeah, a big point that I try to convey when I'm talking about this is that I'm not trying to take away anything from parents who have, you know, kids with no ailments or diagnoses. I'm not trying to say that you're not, you know, I know it's hard. I have 2 other kids that have, you know, don't have any, they're nothing like JT. The thing that I feel like this, like you said, and have addressed, is that it could be something we can resolve. If parents want this bad enough and there are hoops to jump through or things that we need to do to get to the point where we can be financially compensated, because it is a trickle effect where it affects everything in our lives. Unfortunately, money is it affects you know, everyone's life, to the point where if you don't have a lot, it's just a big fat struggle, and it hits just everything is so much smoother in all areas. I'm willing to do whatever. I mean, if you want me to go to school or do classes, or I mean, I'll do whatever I need to do. Just tell me what I need to do and I'll do it. And I mean, and I think that any other parent that feels the same way would too. I mean, if it will ultimately get them to where we can be in this situation where we're all saying our lives are completely different now in a good way, and it's affecting everyone, not just us, but our neighbors and anyone that is involved with our son, or, you know, the teachers, everybody sees it. Strangers, he's not running into people's houses anymore. He's not, you know, trying to get into people's purses anymore. He's listening. He's and I gotta admit, it was really hard in the beginning when I was home all the time, but we've figured out how to make it work, and I'm feeling so much clarity and peace now that I feel like a completely different person, and I am willing to do whatever I need to do to keep this going, because I need to stay mentally healthy for my son. And if I can't do that, then he's not going to thrive. He's not going to get to where society is saying he needs to be by the time he's 18. And if I can't be here to help him get to that point that they say he needs to be at, then he's screwed. He's not going to get there. And that's usually what I feel like happens. And then there's just no understanding with individuals. And again, I'm not trying to knock down anybody, but the fact of the matter is there's just no understanding if you're not in those shoes. You can't understand, and that's okay. But I'm telling you, this will affect you too. This will affect you positively, not negatively. And I can give you argument after argument. I can go on and on about it, about how this will help you too. And I know that there's going to be people who will take advantage of it, but that's why make it harder to become a paid parent caregiver, full-time caregiver, and people that want it bad enough will do it. They'll do what they need to do, just like we did. You know, we all had to do a few things to get to where we are right now. If there needs to be more paper signed, if I need to call and make an appointment with someone so that they know that I'm legit and that I'm, if they want to see the progress from 6 months ago to now. I mean, we never thought that he would do anything that he's doing now. And we can't argue that it has nothing to do with me being able to consistently I mean, it was too inconsistent with the jobs and this everyone's schedule. I had two other kids to juggle, and then my husband. Everyone has their own needs, and as a mom, you kind of have that like, well, you're supposed to take care of all these certain things and yourself too, and if you can't do that, then everything kind of crumbles. And since I've been able to be in this position, I can't. It's just I feel such a different sense of. I have such a different outlook on life now, and I just want people. I want to know who to talk to. Like you said, I want to know who's against it and why, because I don't want to argue with them. I want to change their mind and let them know that this is going to be worth it for you too, not just me. This is not just because I want more money. I swear.
Well, I think Shasta's gonna, I'll also send out, like I said earlier, I'm going to send out we're recording this so that people can view it. I'll also send out a transcript that, Zoom keeps, and I will send out a link to the letter from the folks who opposed this from the Oregon DD Council, whatever they're called. Shasta's hand is up.
Yeah, I just wanted to respond to, where can you advocate for this? I mean, that's part of this core leadership team has been searching and searching and searching for the forum where we can all share our concerns with the decision makers. And thankfully, ASO provided the space for us. This is really the first time that we've had a big public forum because all the other doors we've knocked on have not. So we are looking forward to the legislative session, which starts again in January, and there will be lots of opportunity for public testimony at those. It's a government process, so they can't stop us from writing letters and such. And then also December 9th is the Senate Human Services Committee, where they will be discussing this issue in the morning. We do not have a time for that yet. And then there's also going to be a stakeholder group at 3 p.m. and we're still waiting for details from Senator Gelser-Bluen about what that looks like. In the meantime, any organization that you guys are connected with, whether it's a family network or a big pediatric group or whatever it is, reach out to them and say, will you as an organization support this? We have a what we call our policymaker letter that is just, we believe that this is true and that this needs to happen. And we have over 100 organizations and big movers and shakers in Oregon who have signed on to that letter. And we're always looking for more folks. So I will put that in the chat right now as well.
Thank you. It's also my understanding that the main groups that are opposing this, so DD Services says that they are being neutral, but they have not been terribly in favor of it. And even allowing this once COVID started has been a huge change for them. It's something we've been talking about with them for years. We also, but the groups, it was the Oregon DD Council, but many of the groups that make up the council were not aware of this letter that went out in advance and disavowed it. But generally, the voices I've heard that have been the strongest against it have been the ARC of the Oregon ARC, the ARC Oregon. I know.
The ARC has said that they are neutral on it, and we met with them, I think, a month ago and have yet to hear back. So I don't know if they've actually come to a decision as an organization, but it's a little confusing because the head of the ARC is also the head of the DD Coalition, and the DD Coalition has come out against it.
Yeah. There have also been a few family networks that I have spoken to, and the family networks are state-funded nonprofit organizations in specific areas of the state to help families with kids with disabilities, usually till about age 21 or 26 or something like that. And none of those groups feel comfortable speaking up, is the nicest way to put that. Some of the groups are also part of the DD Council, like creating opportunities in the Salem area, bridging communities down in the Medford area, the ARC of Lane County, Families Connected in Lane County area, CODSN, which is in the Bend area. I'm happy to put you in touch with any of the family networks in your area. FEAT, which is in Douglas County. I'm happy to put you in touch with any of those family networks in your area if you're not already in touch with them. And if you are in favor of this, let them know about that. I think the family networks need to hear from the families. We are also, so we're coming up on about 10 minutes of 3. I don't want to stop any discussion if anybody else wants to say anything or have input, but I did want to say that, you know, we're happy to hold more of these. We can hold them online like we've been doing, which, like I said, we had people sign up from all over the state and even a few from out of state. So online is a great way to reach as many people as possible, but we can also hold these in person, which is obviously more personal in your area. And if that's something that you would like us to do, let me know. Send me an email, put in the chat, whatever's easiest for you. And we'll, we're doing a lot of Autism Friendly Santas this month, but after December is over, we can look in January to holding another one either online or in person. And we'd be happy to do that. Because I think it's vital that family voices are heard.
Thank you again, Toby. This is just so awesome to be able to hear everybody's stories all together. It's really powerful.
Right. Yeah, thank you for everyone who joined us. We really appreciate you taking out the time on a Saturday, and we know it's hard because our kids need caregiving. I have to, last thing I'm going to say is I really loved Shasta's comment in the chat that caregiving is not the same as parenting. And I think that's a really important point to mention and hammer. And it's something that, oh, thank you, Sunny. I put it really clearly to me in a way that I've struggled to say and to articulate. So I really appreciated that. I believe someone had their hand, or someone wanted to say, oh, Whitney, did you want to speak again?
If that's all right. Can you hear me?
Yeah, we hear you.
Okay. Yeah. Okay. And feel free to shut me up whenever you want. It doesn't offend me. I know that I go on. I've been trying to voice my opinion on this to more people more than I ever have. I've always been a little bit quiet about my opinions most of my life up until recently, just because this is something I feel like is definitely worth fighting for if I'm going to. I am employed with my son's respite care company, which is how I became aware of this program to begin with. His wife, who recently passed, is the one that convinced me to get on board with it. I initially was so, because of the stigma of being a paid parent, I didn't do it right away, and she kept bugging me to do it because they were going to close. They weren't going to be able to keep doing what they were doing because their DSPs couldn't go into anybody's home during COVID. So this program actually saved them, in my opinion, because they were able to bring on several parents that had the qualified for it. But when I am voicing to him to join this fight, I'm just kind of being ignored, and I don't know how to express, and I am bugging him, and I'm getting to the point where I think I'm just noise. And I know that I do ramble, but I want to know if there's any suggestions other than just keep poking the bear because he was going to be in this listening session and then decided not to because he said it looks like they just want people who are parents as caregivers. I'm like, no, they don't. I think it's for anyone who is for and against it, but he's busy, I understand, and he is dealing with a lot. So I have been, understanding.
I'm sorry, Whitney, I missed.
But I'm also thinking this. I'm sorry?
I'm sorry, I missed who you said. Who is this person?
This is he's actually my boss. He's the one that started Empowered Services, who was my son's care agency, who was initially helping us, but we didn't really stay consistent with it because it was more work to have people come into the home and more stress than it was to not. So again, we had all these hours, but we never used them because it was just it was harder to use them than to not use them. And then when they offered to have me be hired and paid through this program, it was like, okay, this feels uncomfortable and not right because of just, you know, the way we grow up and, you know, this is our job as a mom or a dad or a parent, and you don't get paid to do this. But it started to make sense when all the positive changes started happening, and everybody, his grandparents, anyone who helps with him, all of a sudden I can actually leave him with people and not feel like people are going to be traumatized or something. Doctor visits are amazing now. Dentist visits are amazing now. Everything is so much better. And he was able to keep his agency going. And I'm trying to tell people this is affecting you too. I don't know how though to really, I know I'm not good with public speaking, and sometimes I go on about certain points when I should be focusing on this one just to get people to hear me and understand my point, because this is not just about me. I swear this is kind of, I think this would benefit everybody, you know, and ultimately, and we can put regulations in place or whatever we need to do, but I'm trying to get him to hear me, and I don't think that he wants to take
Whitney,
the time.
let me break in and say that there are a number of agencies that did sign on to the letter in support. And I think it's important that we support those agencies as parent caregivers. I'm not telling you to leave your agency, but just saying if anyone's looking for an agency, that I would start looking first to those agencies that are in support of this. Many of these agencies were started by parents themselves. I'd be happy to talk with your boss if he's willing to talk with me about why, you know, we ASO as an organization and me personally are in favor of this. But I can understand his trepidation about being here because, you know, even though we tried to say we're inclusive, we want to hear from everyone, let us know what accommodations you need. Clearly, everyone who showed up was in favor. And I can see that as being intimidating. There was something else I was going to say, but
I think he is running into issues with a lot of the parents overusing hours, and it gets expensive for him because he's not getting as
no, it doesn't
much
get
as
expensive
he
for
was
him.
during COVID, because he says as if the parents are using overtime, then his business is losing money.
Well, I
Because-
mean, that's a completely different issue on how it works with the hours. You know, my husband works well more than 40 hours a week, but he does not get overtime. So, I mean, that's a way of running his business. I don't think, and I would be happy to talk with him about that too. But in general, the more you work,
Yeah, this was
the more
not
that-
definitely a knock on. Yeah, I wouldn't.
yeah, but no, let me just say this. In general, the way the agencies work, they get paid money for every hour their caregivers work. So the more someone works, the more the agency is making. I don't know how overtime works though. That's completely different. I did want to say this about testimony, public testimony, when that becomes available with the state, it's very structured. So you don't have to worry about going off topic. When they give you 3 minutes, they're not kidding. They just stop you at 3 minutes, and you'll prepare your remarks ahead of time. You'll read from them. You'll have timed yourself. You'll know that you're under 3 minutes and you're done. It's not free form like this. It's not just come and chat. It's very structured, and we'll help you with it. And you don't have to worry about rambling on. You'll have the chance to condense your thoughts, make sure you fit within the time limit, and that time limit is not extended. So if that helps
And it can be
people-
written. You don't have
Yeah.
to show up. You can
And
just
you can
write
also
in,
just
and they
write.
do read those.
Yeah, and I'm sure the advocates for disability supports as well as ASO would be more than happy to help you with crafting your testimony and reviewing it and making sure you fit within the time and space restrictions. Okay, anybody else? We're just right about 3 o'clock right now. I really appreciate the time and the effort and the emotional work that went into being here this afternoon. As I said, we're going to share the transcript, and we'll also have that in Spanish. And I will share the, no, don't worry, Whitney. I'm just responding to her in the chat. We will also share your emails, unless you ask me not to, with Advocates for Disability Support, so they can keep you abreast on what's going on and how to support this. We will also have updates in our ASO newsletter, as well as on our Facebook page and other social media. Okay, Susan, I'm glad to hear that. We will make sure that everyone here, as well as everyone we can get out information out to, knows about opportunities for testimony. And we would be happy to have as many people provide public testimony as possible, whether written or oral, and we'll be happy to help you with crafting that as well, to take away some of that anxiety. Okay. So thank you very much. Thank you to our folks who were here from Advocates for Disability Supports, to Shasta Kearns-Moore, Lisa Ledson, Jennifer Murphy. There's somebody else I'm forgetting, and I apologize. But thank you.
And Kelsey.
Oh, and Kelsey, okay. And Romy, of course. So thank you all very much, and take care. I hope you have a wonderful holiday season, and we'll hope to keep in touch, and you'll hear from us soon, particularly December 9th, when we find out more about the bills, the 2 bills that are being put forward in the legislature. Okay. Thank you all very much. Take care.
Thank you. Bye-bye.
Goodbye.
Bye-bye.